Hey guys, it's Dr. Justin Marcagiani here. Today's video is going to be a live Q&A. I'll pull and answer some questions up here as we dive in. One of the topics I wanted to talk about is probiotics and making you bloated, or making you brain foggy, or making you feel worse. This is a big issue I get with patients all the time. I want to dive into that topic today. Any other questions here, feel free to chime in on the chat. I'll be happy to kind of dive through and answer some of them as we go along here. All right, so first thing is, when you take probiotics, right, you can increase gases in your gut, methane or hydrogen gases, if we already have bad bugs there, like dysbiotic bacteria, Citrobacter, Fusobacterium, Proteus, Morganella, Strep staph, right? These are bad bugs in the gut. If we already have a lot there, sometimes throwing probiotics in there, it's kind of like chumming shark-infested water. You can kind of create a little bit of a feeding frenzy, and that feeding frenzy could be extra methane or hydrogen. Also, you can get D-lactate production from these probiotics as well, and D-lactate can significantly affect motility. It can also cause brain fog issues, definitely throw off your digestion, bloating, gas, diarrhea, constipation. Again, with some people, probiotics can really move the needle from a diarrhea standpoint. It can be good if you have like an acute E. coli infection. It can, there's data on that actually helping to crowd some of those bugs out on the E. coli dysbiotic bacteria side. And so there are some benefits, but if you have chronic digestive issues or you find yourself sensitive to probiotics, you gotta look in and say, okay, what's the mechanism here? Why am I feeling the way I'm feeling? What does it mean? And then what does this tell me about what my next step should be? How should I work on getting to the root cause? And typically you have to work on, it's like, I got my lawn over there, right? I'm looking at it. If I had a whole bunch of weeds over there, I wouldn't pay my lawn guy to go throw a whole bunch of seeds down. We'd probably spend a little bit of time pulling all those weeds up, kind of really create space, and then throw down some seeds as well as some fertilizer to really allow that extra space to be taken up. And any good lawn guy will tell you that if the more you get good quality grass in your lawn, that grass actually crowds out the weeds and prevents a lot of weeds from growing. So one of the first things you got to do is you got to clean out the weeds. Then you got to come in there and specifically take up the space that those weeds would be taking. You take up the space what the weeds would be taking, then the grass that's now in that spot can really, let's say, improve the immune system of that lawn and make it harder for the weeds to grow back. So I hope that helps on that sense. I want you guys to kind of look a little bit deeper on that. What time of day should I take my vitamin D3? That's one question here. So I think it's better probably to take it in the morning time, just because if you think about vitamin D, how is it made? It's made with the sun. Right? You're going to get the sun at 10 o'clock at night? Probably not. So I would say I try to keep things kind of in line as natural as possible, more than likely better in the morning. Now, that being said, if you forgot to take your vitamin D and it's nighttime and you're sitting there pulling out your supplements, should you take it? Sure. As long as it wouldn't affect your sleep and wouldn't overly energize you, which most of the time it shouldn't. Every now and then you find someone that's like, yeah, vitamin D gives me good energy. That's the case. Do it in the morning and skip it. But if it is not going to energize you and throw off your sleep, I have no problem with you taking it at night. But I think morning's probably a really good idea to do it, just because that's how our body would naturally do it. Great question on that front. I'm going to keep on pulling in some more questions here. I'm reading Supergut and how L-Reuteri is very beneficial. Supergut book has a SIBO probiotic protocol where you make your own yogurt with massive amounts of bacteria. Have you seen this? I've not heard of that, but yeah, I definitely use L-Reuteri. L-Reuteri is used in a lot of baby probiotics for like infants and stuff. I think it's also used in a lot of vaginal probiotics. So when we're trying to deal with like chronic UTI issues, bacterial vaginosis, yeast infections, that's one of those good probiotics that show a lot of benefit with helping improve vaginal health. There's actually one probiotic I think I like that may have it in it. I'm going to just see if I can pull it up on screen here and just double check that. But yeah, I do like that. I think that's a good one. It's really good. Very good, very good. Let me just pull this up here. All right, cool. Let me kind of move on. I'll come back to that. All right. Now, Jay, I've been diagnosed with urticaria and flare-up when my body temperature rises. I was wondering how I can cure my hives. So, yeah, I mean, basically, when you have histamine sensitivity, right, hives are going to be a manifestation in the skin of what that looks like, right? Obviously, hives or wheals, they kind of these kind of wheal lesions. They kind of boil up a little bit on the skin. Obviously, they're going to be itchy. It's usually just a sign of a histamine issue. Now, you have to get to the root cause of why that histamine is going on. Of course, once you have hives, definitely temperature sensitivities can be a driving factor of that. Again, it's not the root cause, but it can be a trigger. Now, the question you have to look at is, well, why is that happening? What's the root cause? Are you eating a bunch of high histamine foods? Probiotic-rich foods, fermented foods, citrus-rich foods, aged meats. Now, a lot of times those foods are not the root cause. So you kind of have to draw a line like root cause and trigger, right? So you can have things that trigger it may not be the root cause. Like it's probably not the pasture-fed bacon that's, aged a couple of days that's the root cause, or the dry aged steak that's the root cause. Normally, there's some level of inflammation in the gut. A lot of times the immune system is kind of off kilter in the gut. So typically, basophils are going to be the big ones that are going to start producing a lot of the mast cells. Basophils, once they go from the blood into the tissue, they become mast cells. Also, you see eosinophil response too can also drive a hive response, but it's usually those basophils. It's an immune response, and vasodilation is part of it. Now, the question is why? There's different nutrients that can help hives. So, of course, histamine degranulators can be helpful, like DAO. Now, how do you make DAO? That's an enzyme. Vitamin C, B6, those are some really important ones. Good kidney function is also a good one. You got to look at the root cause. Now, most of the time with hives, there's going to be inflammation from food allergen issues. If the immune system is overly ramped up, what could drive that? Gut permeability could also drive that. So if you have gut permeability, what's driving the gut permeability? Poor digestion, inflammatory foods. Okay, if you don't break down the foods into their smaller peptide-like molecules and they're larger, they're likely to be immunogenic, meaning overstimulate the immune system. I would say after that would be bugs. So this could be bacterial overgrowth. It could be fungal overgrowth. It could be parasite infections. And so once you start to have your immune system out of whack, then yeah, you probably have to be more careful with histamine in your foods. You probably need to have hydrochloric acid or enzymes. You may need some natural histamine degranulators like quercetin, like bromelain, like stinging nettle. These are all good things that you can add in to kind of help. But you really got to look deeper at the gut. And the adrenals can play a role too, because the adrenals are a powerful anti-inflammatory, right? They produce cortisol, that's a glucocorticosteroid. Glucocorticosteroid means it has a natural anti-inflammatory component on the corticosteroid part. Gluco meaning energy, corticosteroid, anti-inflammatory. So a lot of places to look, but that at least gives you a good starting point. Good question there. Okay, how does one detoxify from radium in the drinking water? So first thing is good reverse osmosis filters, and it take care of most of that problem. Okay, RO, get a 5 or 6 stage RO filter under the counter. You're going to be in good shape. In my home, I'll do a live video, but I have an Aquasana whole house filter with a pre and post filter downstairs. I use that. That just kind of generally cleans things out. It's not perfect, but it gets things pretty clean. Why do I have that? Because I want clean showers. If I wake up in the middle of the night or before bed and I'm not near my RO filter, I want water that's clean enough where I feel comfortable drinking it. Second, RO is going to make it even cleaner. So when I make my coffee in the morning, that's going on my percolator. Any water I'm giving to my kids, smoothies, shakes, water bottles, that's all going to go from the RO, which you have the whole house. It's carbon-based filter with pre and post filters on there. Then you have the RO 6-stage filter system, and that's going to get everything else out. Pharmaceuticals, plastics, chemicals. It should even get the radon and those kind of things out as well. And so that's what you'd want to do. And if you didn't want to make the investment like I did with the whole house, you could just skip it and just go with a really good 5 to 6 step under the counter filter. That would be pretty good. I just do it more for the convenience and for the showers. Worst case, you can always get some shower filters, and you'd be good there. Great question though. Okay, excellent. Why do I get bloated after I eat boiled eggs, but scrambled eggs do not bother me? That's a great question. So why do I get bloated when I eat a boiled egg? So I'm guessing hard-boiled egg. Well, the question is, are you overly cooking it? Is it overly oxidized? Sometimes when you oxidize the cholesterol and the protein, you can make it potentially a little bit more allergenic. So it's possible that you've increased the allergenicity of the egg by overcooking it. Now, let's say you've hard-boiled it, but now the yolk in the middle is still a little bit soft. That's interesting. I would look at egg quality, but I have no idea on that one, really. Outside of maybe you're using a good fat in it, or you've cooked the eggs just right on the scramble side. Not really sure on that. Need more information. Need more You need to control more variables to really know for sure. Okay, good. Dr. J, I've been diagnosed with chronic or with the cholangenic urticaria. How do I fix it? So same thing I mentioned earlier. You got to get the food fixed. You got to get the digestion fixed. You got to look at the gut microbiome, figure out what those stressors are. You have to do your best to cut out the histamine that's driving it now, the triggers now, and then you can use some natural antihistamine support in the meantime. That should help quite a bit. L-reuteri is a super gut. It's also being used to raise testosterone in men. Check out the book. I think you will like it. Thank you, Dr. J. Yep, excellent. Thank you. Yeah, I don't know about raising testosterone in men. I mean, I guess anytime you fix your gut, right? I mean, I would, I hate to say, like, does this one bacteria do that? I mean, probably not. Like, usually everything interplays, right? Like, if you fix your gut absorption and gut inflammation, that's going to help a lot of things, right? Because if you're absorbing zinc better, if you're absorbing your amino acids better, is that going to help your metabolism? Is that going to help your hormones? Yeah, it will. Is that one little probiotic going to move the needle that much? It's hard to say. But either way, anything that helps your gut, helps you digest and break things down and calms down your immune system, I think is going to have a good response. So that's good. Thanks for sharing. Okay, very good. I've heard mixed thoughts of taking K2 with D3. Some say you should, others say you don't have to. What do you say? I think it's good to take vitamin D with K2. I think that's fine. I don't have a problem with it. I mean, K2 is going to help calcium go back in the bone. D3 helps with calcium absorption. So I think there's some synergy with vitamin D and K. Of course, you can always add in a little bit of vitamin A or a little cod liver oil, and then you have that kind of the whole fatty acid kind of synergy with the vitamin A, K, and D. I don't have a problem with that. Vitamin D, I think, is even okay by itself, as long as you're getting good leafy greens, some grass-fed butter. I think if you're maybe vitamin K deficient, then, or your diet's not the best, then I think you should get your vitamin D with K2 just to be safe. Most vitamin D toxicity issues tend to be when you don't have the other fat-soluble vitamins with it. So I think it's okay to do that. All right, Harley writes in, that's Jay, I hope you're doing great. Any advice for someone with gallbladder having floating stools, even after having dialed in HCl, enzymes, and bile salts? Thanks in advance. So you have to figure out why your stools are floating. So if you're on the fence, you can always get a stool test and see if you have steatocrit on the stool test. That will tell you if there's malabsorbed fat. Some people have floating stools because they're just having a ton of fiber in the stool, and the fiber can float. And so you first have to say, is that floating because of fat, the oil and water kind of separating? So do you have excessive wipes when you go have a BM? Does it leave skid marks or streaks on the toilet seat? Those are big questions. Do you get bloaty or gassy due to fat? Do you have any like bile acid diarrhea, or do you have like any diarrhea or significant malabsorption issues, right? Those would be important things to kind of dial in on. Just because it's floating, it may not necessarily be because of fat. So if you dialed in the HCl and you've kind of really worked that one up by itself, and then you've dialed in the enzymes and you've worked that up, and then you've dialed in the bile salts, then it may not be that. But I always say make sure that's 100% dialed in. Next test would be to look at a comprehensive gut test to see what's going on with your fat there. That will give you a window with steatocrit, and that should hopefully give you a little more confirmation. Good question, though. Mold causes gut permeability, and my doctor thinks I need to be on cholestyramine for a year. I told him that will make me worse. Do you use cholestyramine? Thank you. I don't. I mean, that was used in the 80s as a cholesterol medication, so it can lower cholesterol. So my concern with a cholesterol medication is that you can potentially decrease or negatively impact your hormones. I understand the binding effect that you're getting with the cholestyramine. I think there's other ways you can use bentonite clay and activated charcoal and citrus pectin and zeolite and other kind of more gentle binders that will still have a good impact breaking down, or I should say binding to mold. I'd also work on glutathione and NAC, and I'd work on getting your environment fixed. I wouldn't jump to a medication that could potentially impact cholesterol and could impact your hormones. So I would actually stay away from that one, and I would use a more gentle binder and all the other nutrients. Plus, I don't ever go after mold directly from a detoxification standpoint until digestion's fixed, till the gut's fixed, till the hormones are stable, because so much of mold detoxification goes via hepatobiliary, meaning liver, gallbladder, gut. So I want to make sure digestion's good, fat absorption's good, we have good gut immune system, like the microbiome is really good microbiome, good gut bacteria, not much dysbiosis, making sure all those things are dialed in before we start going and pushing mold detoxification. Plus, I'd also make sure your environment is dialed in. So if you have any leak issues or need things remediated, get that done. Increase the air filtration. You can also look at doing some fogging in the meantime. Get the environment dialed in first. Good question, though. Okay. Is there an answer on why antibiotics like azithromycin caused me severe phototoxicity and severe fatigue for years? The first year after I took it, I was having seizures from sunlight exposure. That's just a side effect of those medications, personally. So, I mean, if you go here, let me just pull this up here. If you go here, I'll pull this on my screen here if I can. Okay, so first things first, right? If I go here, right, and I just type in azithromycin, just so you guys can see it. I know the spelling's wrong. Google should fix it for me. And mitochondrial dysfunction. This is the major mechanism. This is why I try to tell patients, try to stay away from antibiotics unless you absolutely need to, because you can severely impact your mitochondria. So azithromycin causes mitochondrial toxicity. This is the reactive oxidation species, DNA oxidative damage, right? So you can see it can significantly cause other issues going on. It can negatively impact the mitochondria, look, mitochondrial toxicity. So this is more than likely what happened. You just really screwed up the mitochondria, lots of oxidative stress. Then, of course, you can have rebound overgrowth, and that's where you start to have bacterial overgrowth issues like from dysbiotic, gram-negative bacteria, right? Your Citrobacter, your Proteus, your Fusobacterium, your Staph, your Strep. And then, of course, you can also create fungal overgrowth as well. So this is part of the reason, let me give you guys full screen, why you got to be careful. I mean, you can look at this. This is mitochondrial toxicity due to azithromycin, right? Toxicity, right? This is real stuff. Aerobic glycolysis, DNA damage, mitochondrial toxicity. So you got to be careful. So antibiotics are great if it's your last case, but always try to use natural things first. Not saying you shouldn't touch an antibiotic, just try to prioritize it. Like, you have your list of things that you're going to go to, put that at the bottom of the list. So block eustachian tubes. So, I mean, in chiropractic, there's an adjustment. We would take the ear, do it more in babies, because babies, if you look at like their anatomy, their eustachian tubes are more parallel with the ground, so more flat, so you don't get the drainage. And so you can take the earlobe like this, and you actually would, try to visualize it, counterclockwise turn, and then pull all the slack out of it as you counterclockwise turn, and then you pull, and you'll actually hear a little pop. You got to pull all the slack out, and then a little tug at the end, and you'll get a little pop, and that does kind of open the eustachian tube up and help it drain. That's a really good technique I learned in training. Also, you got to get the sinus canal dialed in, right? If you go look at the anatomy of sinus and ear anatomy, and most people don't realize this, but if you have a jacked up nose, I mean, it goes right to the ear. And so most people, if you see right here, you look right here, these turbinates right here, right? This is up your nose, then you have the three layers, your upper, middle, lower, and then you have your eustachian tube right here. You can see it has this downward kind of angle. Like I mentioned, infants a little flatter, but you can have bacteria and junk up here move its way to the ear and then create inflammation. It causes an inner ear infection, right? And then, of course, you have an outer ear infection. That's going to be like swimmer's ear, right? That's bacteria from like the water or the pond coming in, affecting the tympanic membrane. That's the eardrum, right, on the outside. And then you have an inner ear. That's going to be an infection that either the eardrum pops and stuff from the outside goes in, or it's from the nose and it goes through this eustachian tube here. So you got to clean out the nose. And this is where I have my saline flush video that you can take a look at. I use Xlear. I'll use Xlear Rescue or Xlear Max are really good. and then I'll do that, and I'll do the flushing of the sinuses with some silver and xylitol, which are natural biofilm busters. That works really good. That helps knock down any of the crud, and then you want to ideally clean that out. And again, you can also do a little bit of hydrogen peroxide in the ear too, dilute it down a little bit, and that will help anything that's brewing, but you got to actually get it from the inside out. And sometimes if everything's really jacked up in here, meaning really constricted, you may look at a little Afrin or what's it? Metallazine? Afrin. That's basically going to be a vasodilator. It's going to open all these things up so then you can clean things out better. Because if it's really constricted, you may not be able to do a good flush on that. So again, I've thought about this and deal with a lot of patients that have these issues. And so take a look at my video on that topic. That should be really helpful. Good question. Try to do some of these live videos with my screen share as well. If you guys know how I can bring like a drawing board on the screen, that'd be ideal. I want to hook up my iPad here, and I like to be able to just draw stuff out, so then you can see half of my screen. I'm drawing stuff out. I'd love to be able to do that. I'm kind of searching online how to do it. I know you can, so if you guys know, please let me know in the comments. I'll come back later to see if someone can send me like a tutorial on that. All right, the thing I know, other people who took it didn't get it and horrible chronic side effects. Yeah, I mean, again, with the antibiotics, there's going to be a genetic predisposition, of course. Everyone's going to be a little bit different in their side effects. Some, they'll have no problems. And of course, the rebound overgrowth regarding bad bacteria and yeast can definitely exacerbate that. But I mean, I showed you the data earlier, so it's a legit issue. So you really, I mean, I would want to do an organic acid test, utilize and fix all of the nutrients that are missing, really supercharge the mitochondria with good creatine and ribose and CoQ10 and B vitamins, fix the gut, make sure your adrenals are dialed in, really support all the antioxidants as well. There's a doctor in New York by the name of Dr. Bernard Schulowitz, and he's a protocol for asthma from SIRS. Have you used this protocol? I have not. Let me just make sure I understand what SIRS is. I'm pretty sure I do, but all these acronyms, there's so many. Yeah, chronic inflammatory response syndrome. So you got to look at the root cause, right? Most diagnoses, they're really just for an ICD-10 code, so someone they're paid by insurance. Doctors can get paid by insurance, and so they can prescribe medications, right? So you got to look at the root cause. What's driving it? And so I look at, okay, this is what a patient has. This is their inflammatory bucket. These are all the inflammation vectors here. So I just try to look at it and say, okay, what's in that bucket? And we're just going to start pulling things out. Okay, diet stressors, food allergens, dysbiosis, crappy digestion, whatever those things are, we're going to just work on pulling those things out one at a time, one at a time, one at a time. That's kind of how I look at it. And then as we pull them out, I mean, we believe, and most of you probably have a similar belief, is that your body has the ability to heal, right? We are set on automatic to heal. If I cut my finger, I don't have to think about my finger healing. It will heal. It's on automatic to heal. Now, if I have a vegan vegetarian diet, very low protein, very low fat soluble vitamins, will that heal? Yeah, but just slower, right? So as long as we give the body what it needs, building blocks, right? We don't stress it. We do all the right things to allow it to heal. Good sleep, good water, good diet. The body's going to heal. And so that's kind of how I look at it. I don't get intimidated by weird diagnoses. I just look at all the stressors that could be coming in and preventing the body from healing, and I just kind of pull those things out or address them one at a time. And like magic, the body can heal. Of course, the unknown is how much psychological, emotional trauma is active, right? If someone has a ton of embedded emotional, psychological trauma, and that is like the linchpin that's really holding things back, then I'll refer those patients out to get additional support, like utilizing EMDR or neurofeedback, disentrainment, or EFT, NLP. There's lots of great techniques that can work on the trauma at a subconscious level. And then that kind of takes the foot off the gas pedal of the sympathetic nervous system, and it allows that parasympathetics to go in a greater response. And the parasympathetics that's the vagus nerve. That's what's helping you heal and recover and feel a lot better. So great question on that, guys. I'm going to wrap this up here unless I get another question in the next minute. Antibiotics can create a lot of side effects. So we'll probably chop this up, make another video on it. But like I mentioned earlier, if you take antibiotics and there's a genetic sensitivity issue, you can create excess oxidative stress. There can be issues regarding mitochondrial damage, even DNA damage. And then, of course, you have the rebound overgrowth regarding bacteria issues and then yeast issues. And a lot of doctors now are getting more keen to it, and they're even giving diflucan along with an antibiotic. But diflucan actually has its own level of side effects over time as well. So you got to be careful in regards to these medications. They can really negatively impact. I've had a couple of patients that are in my care right now, and you look at their history, and there's a lot of antibiotic usage right up until a lot of their symptoms kind of manifested, and they said, I got to reach out, right? I'm feeling sick. And so the antibiotics tend to be a big driving factor. So if you use them, be careful and make sure you use good probiotics, potentially even during, away, but during, and then even after, very helpful. And then you can always use things like Saccharomyces boulardii as well to kind of prevent that rebound yeast overgrowth, as well as a good lactobacillus bifidobacter antibiotic, or I should say probiotic, to kind of help counteract the antibiotic side effects. Hope it helps, guys. All right, if you enjoyed today's video, please let me know. Put it in the comments. Really appreciate it. Give me a thumbs up. Give me a share. Let me know your thoughts on it. And feel free and share with family or friends. If you want to reach out to myself, my staff, I'm here to help worldwide. There'll be a link down below if you want to reach out. Feel free and do so with that link. One more question popped in. What are your thoughts on acne coming from the lymphatic system? So the lymphatic system is nothing more than the interplay between like the tissue and the blood, right? And so all that junk from the tissue and the blood has to move through the body, right? And if things are stagnant, then you're going to feel things like lymph nodes and congestion. And so you can do gentle things to support the lymphatic system, like dry brushing. You can go on Amazon, get a dry brush, and you can just gently just take these lymphatic areas here down the SEM or in the axillary area, and you can just gently brush it right back to your heart. Because the heart, all that fluid goes back to the heart, and then it gets pumped through right atria, right ventricle, and then back to the lungs, and then it comes back oxygenated. So you can just flush it all back to the heart. If you go back over the shoulder, bring it back to the heart. If you go in here, bring it back, and just gently dry brush. I have a whole body vibration device over there, so I can just jump on my whole body vibration for 5 minutes. That'll move things up and get things moving. Again, why do you have lymphatic stress to begin with? There could be a lot of bacteria or junk, or there could be a viral issue. There could be inflammation. If you get inflammation down, cells don't agglutinate or stick as much. And so get the inflammation down via food, via good hydration. You can look at anticoagulants that are more natural, things like ginger. You can use things like systemic enzymes like lumbrokinase, nattokinase, serrapeptidase. You can use things like ginkgo, actual fish oil can be really helpful. Anti-inflammatory, keep things kind of moving. Poke root is wonderful. Red root is wonderful for the lymphatic system. Those are all really good things out of the gates. All right, awesome question, guys. Put links down below. Feel free to check them out later, and put your comments. Appreciate it. Take